Good evening, everybody. My name is Stephanie Wu. I am the Public Education Chair of the Scleral Lens Education Society. And tonight we have a really special presentation for you, and it's about marketing and growing your scleral lens practice. And it's by Jason Jedlicka, and he is an awesome person. He is not only the cornea and contact lens chief at Indiana University, but he's also a residency and fellowship trained optometrist, and he completed a residency in cornea and contact lenses at Pennsylvania College of Optometry, and he also completed a fellowship in anterior segment disease at the Minnesota Eye Consultants. He was also the chief of contact lens service at the University of Minnesota Department of Ophthalmology. So Dr. Jedlicka knows a lot about scleral lenses, and not only is he super smart, but he's a really nice guy as well. So I think you're in for a real treat tonight. Just a couple housekeeping things here. If you want to ask any questions during the webinar, please just feel free to type them in the little box that you see there, and it's towards the bottom right-hand side of your pop-up windows. And what happens is I'll be asking some questions to Dr. Jedlicka throughout the webinar, and we'll try to answer as many as we can, and then after the webinar we'll try to answer many more. So please feel free to ask any questions at any time. But of course we want to thank our sponsors first. Without our sponsors, these webinars would not be possible, and we really appreciate the support that they have given us throughout these years. So I'd like to first start off with our first platinum sponsor, which is AccuLens. AccuLens creates the Maxim, the Comfort SL, and the Easy Fit, and these are all scleral lenses. And next, we have Paragon Vision Sciences, who creates the Normalize and the ICD. We also would like to thank Visionary Optics, who creates the Europa scleral lens and also the Elara. XL Contact Lens has the Atlantis and the Atlantis Pro. Blanchard Contact Lens has the MSD, the One Fit for normal corneas, and the One Fit cone. Alden Optical creates the Zen lens. And of course our silver and bronze sponsors. Thank you so much to all of our sponsors for all of your support and assistance throughout the years, and we're really excited to just be a part of this amazing group with them. And with that, I will turn it over to Dr. Jedlicka.
Thank you, Stephanie. Thanks everyone for being here tonight. So it's my pleasure to try to give you some pearls that I've accumulated through the years on building a scleral lens practice. So Stephanie gave you a little bit about my background, but I also had the opportunity in those years to build a private practice that was a specialty contact lens practice that was heavily based in scleral lens fitting. So a lot of the things that I'm going to talk about tonight are things that I personally did in my own experience or things that I found were helpful. And so again, hopefully there's some things in here tonight you can take out and implement in building your own scleral practice or continuing to build the one you already have. So there's different types of practices that someone may have build a scleral lens practice in. One of them, of course, is a hospital or university-based practice, and these tend to be good sources for patients for scleral lenses just because of the nature of the patients that are seen in this type of a practice. There's also the group practice, which may include multiple ophthalmologists and optometrists working together. Again, this type of practice has a great potential for scleral lenses as you may have multiple providers who can refer to one person who anchors the scleral lens practice. And also you may have subspecialists within this type of a group, so the patient population there lends itself to scleral lens utilization. Also, you can certainly build a scleral lens practice as a solo practitioner or a group of just optometrists. This can be a little more challenging, but if you work hard and network properly, it can be very rewarding as you have more control over your practice and can really manage it the way you want to. So you want to build a scleral lens practice, and there's certain things that you're obviously going to need, and some of this is obvious, but just as a foundation to the webinar. You're going to need some instrumentation, and some people choose to have some pretty sophisticated instruments. If you have the means to have these instruments, it can set your practice apart in technology, and it can help you with the learning curve with becoming more expert at scleral lens fitting. So OCTs or special imaging devices are nice to have if you can, although certainly not necessary. Also, fitting sets, of course, you're going to need those because unless you have the opportunity to somehow do a lot of empirical scleral lens fitting or some type of instrument that directs how you fit lenses, most people aren't going to have that available to them, so fitting sets are also necessary. There are other accessories that we'll have in our practice that make things go easier in the fitting process, and having these accessories, again, you want to look the part of a scleral practice. You want to make sure you have all these sort of things available to you before you start into the practice of fitting scleral lenses and then find that there's certain things you're lacking. Knowledge is another big thing that we need if we're going to build a scleral lens practice. If you're not a good scleral lens fitter, if you don't have the expertise, people will recognize that right away, and it'll be difficult to build a practice when you don't instill confidence in those patients that you're already seeing. And then, of course, we need patience. So a lot of the internal and external marketing things we're going to discuss tonight are geared towards bringing people into your practice. But again, if you want to serve those patients optimally, get the referrals, and do a good job taking care of these patients, if you want them in, you need to have some expertise built up first. So let's talk about what we need and how we're going to get that. The first thing I want to talk about, I've kind of separated this into 3 parts into building your practice. And part 1 is to build your practice by building your own skill level at fitting scleral lenses. If you have this as the cornerstone of what you're building on, you can be successful. You can build a successful practice because you're going to take good care of patients. On the other hand, if you launch into building a practice and you're not able to deliver on quality fittings, it will be very difficult to build that practice. So there are several places that we can gain knowledge of how to be a better scleral lens fitter. There are publications such as the Guide to Scleral Lens Fitting. There's also videos online. There are places that you can read about how to be a better scleral lens fitter, how to do this. So even for someone who's just starting out, the basic information is there. There's also workshops available that you can get hands-on experience, whether they're at a meeting, national or local, or whether you actually invite someone from a lab to come to your office, and sometimes they'll do that. And you can line up patients, and they're often happy to come into your office and see a number of patients and walk you through this process more quickly. There are lectures at all sorts of meetings that you can attend on scleral lenses, webinars such as this, and the archived webinars that we've done in the past, as well as organizations like GPLI puts on. The GPLI webinars are all cataloged on their website as well. So again, lots of opportunity to learn about scleral lenses through publications, lectures, and media. Again, if you don't know what you're doing with fitting scleral lenses, it's going to be really difficult to build that practice. So once you've gotten the groundwork done on learning about proper scleral lens fitting, you obviously need to get a set of lenses, and you need to become familiar with those lenses. You need to learn how to use them expertly. And you need to know what modifications you can do with this lens to optimize fitting. So again, I encourage you to make sure you've read fitting guides and read it again once you've used it a few times to make sure there isn't anything you're missing. Watching the webinars. Many of the manufacturers of lenses on their websites will have instructional webinars on how to properly fit the lenses. And again, scleral lenses, if you're going to invest and build a practice in fitting these, again, you want to be expert at them, so you need to make sure that you're using the lenses properly. You will have opportunity to talk to consultation at the labs, and it would even be a good idea, I think, as you're beginning the process of fitting your first patient or two, to talk through experiences you have with these lenses with consultation. And they can talk through, recommendations for improving the fitting process for you as well. We need to understand how to modify lenses to the needs, and again, mastering the art of fitting lenses that you have access to. You're going to need to really know how to optimize fits. It's fine to be an average scleral lens fitter if you don't want to build your practice or have scleral lenses be a foundational part of your practice. But if you want to set yourself apart, you need to be expert at fitting the lenses you have. And then once you master a design, maybe you fitted enough patients in it, and you've gotten into some of the finer manipulations of the lens design, such as torics and things like that, I would encourage you to go for another set and build your catalog of lens options, because no matter how good a lens design is, there's always going to be certain patients that might just be naturally better fitted with one design than another. So if you have access to a few different designs and have mastered each one of them, it's going to allow you to streamline the process considerably, which is very important in building confidence in our patients. I would say too that as you work with a lens and get comfortable with it and talk to the consultation at the companies you work with, make sure that you communicate to them, how excited you are about working with their product, how you feel like you enjoy the process, and that you're really trying to build this practice, and they may also be able to put you in their referral network for when patients request information about fitters. Also, they may on occasion, I know that in the past when I've looked for somebody, when I had a patient who was relocating or contacting me from other parts of the country, will often contact the labs and say, do you know anybody who's fitting your lens in this part of the country? So that's another way to get referrals, is to make sure that the labs are aware that you really want to build this part of your practice, and you're happy to take referrals if anybody's looking for a fitter in your area. Again, getting back to knowledge, it's so crucial to prove your skill level at scleral lenses that you really are that adept. One of the ways you can do that, of course, is by being a member of the Scleral Lens Education Society, and many of you probably already are. The next step in the process, though, is becoming a fellow of the Scleral Lens Society. And many people want to know, I'm a member of the SLS, but I'm not listed in the fitter directory, and things like that. How do I get in the directory? And to do these sort of things, you need to become a fellow. And to become a fellow, there's a process which is outlined on our website that talks about it, but it's just a matter of proving that you are adept at scleral lens fitting so that the society can feel comfortable recommending you to people who are interested in scleral lenses. It's not arduous. If you fit scleral lenses already, you just need to compile some case reports or some lectures or articles you may have written and submit that. And again, becoming a fellow, you do get into the directory of fitters where patients can find you. But just as importantly, we have people contacting us regularly looking for fitters in different parts of the country, and so we can direct patients to you as a fellow. There's also the occurrence when a patient, when for example, if I had a patient that I was caring for that was a scleral lens patient and they were relocating to another part of the country, I would, again, first start by looking at who's available in the Scleral Lens Society among the fellows in that part of the country and move from there. So that's a way that we inter-refer as our patients move about. Some other ways that you can set yourself apart by demonstrating a skill level is by joining, becoming a fellow of the CLSA, a diplomate in the contact lens section of the Academy, because the National Keratoconus Foundation has a very active patient portal where people can ask questions and find out more information. And when someone requests information from NKCF, about where can I find a good fitter, they tend to use the directory of Fellows of the Contact Lens Society and the Fellows of the Diplomates in the Cornea Contact Lens section of the AAO as their go-to list of who to refer patients to who inquire of them for contact lens expertise. So these are just some ideas on how you can build your skill level, become an adept fitter, become an expert fitter, and then so that you know that you're able to take good care of patients, and ways to demonstrate to the world that you are able to fit scleral lenses and take care of scleral patients. So the next section here is to build your practice, and that is through more internal marketing and preparation for that, that volume of scleral lens patients that are going to find you eventually through other means. So one of the things that I want to talk about again is creating an office environment that speaks to you being a scleral lens expert. So we've already talked about how you can gain the knowledge to become recognized as a scleral lens expert. But there's also something that you need to do to create an image or a persona for your entire office and yourself to give the right impression to patients. Again, we talked about the instrumentation we want in our office. The basics are you just need an exam lane and a fitting guide. But obviously, if you have these other types of instruments such as cameras, OCTs, topography, you have the opportunity again to streamline your fitting and give patients the impression of a more advanced practice, one that is current in technology, and again, it just instills confidence. So these things are great to have if you have the means just to offer a more thorough and well-rounded fitting experience. The fitting sets we talked about, you need to have these available to you, and you need to know, again, how to use these and pull these out for each individual patient. Within your office, you're going to want to have all the accessories available. So again, preparing your office by having the supplies needed, not only for your utilization in your exam room and in the clinic, but also for potentially for sale to patients as they need supplies, that you can also provide those supplies to the patients. What scleral lens lane would be complete without a Ratten filter, of course. This is something which is important for visualizing very thin amounts of fluorescein. If you haven't gotten the opportunity to have Ratten filters in your exam rooms, these are available through the labs if you just ask. And so again, just one thing that may slip through the cracks, but one thing which again I feel is very important to optimal fitting. So if you don't have Ratten filters available near your slit lamps, it would be something which you'd want to get in advance so you're prepared for doing optimal fitting. Another thing which is really convenient is having scripts for the accessories, such as the filling saline or any other type of solutions that you want the patients to use with their scleral lenses, to have them pre-printed if possible, so that you don't have to spend the time to write this complicated prescription out every time for how to use the saline vials, if that's what you choose to prescribe, or whatever lubricating drops you wish to fill. We have these pre-printed or copied in advance so that I can simply fill out the patient's name and sign it. Just save some time, and again, it looks a little more professional at the time of doing the dispensing when you can hand the patient their prescriptions in advance. Also, having an instruction sheet on proper insertion removal techniques and care is very helpful. The process of fitting somebody and dispensing lenses is a big process, and for a lot of patients there's a lot of change in how they're about to proceed with their contact lenses, and there's a lot to remember. So the easier we can make it on patients by having information sheets or pre-printed scripts in advance that go over how to use things will be easier, because as they get home then they can refer back to that if they've forgotten. Some people choose to have pre-packaged kits with things like sample saline, Again, the prescription for the saline cleaning, artificial tears, whatever you want to do to package this up in a bundle and market for sale, whatever's appropriate, whatever you feel like you want to charge the patient. Maybe you do this to make a lot of money, but you do it to make it very convenient for your patients, and again, create a perception that you're prepared and this is a normal part of your clinical practice to fit and dispense scleral lenses, so you're prepared for this and it's just part of your daily routine. If you go through the trouble again to have these prepackaged accessories, for example, again, it would demonstrate to the patient this is something that's very routine, and we do this a lot, so it presents an image as well to have these available. One of the best things to do, in my opinion, internally, once you've established, the equipment you need in the exam rooms and you've prepared yourself and your physical plant for scleral lens fitting, is to engage your staff, because your staff can be your greatest cheerleader in building your practice. We take opportunity to fit our staff in scleral lenses, even if they don't end up needing them. We want them to have the opportunity to see how comfortable they can be, how easy they are to work with once you have proper training, and how sharp the acuity can be. So we like to introduce these things to our staff through personal experience. We also like to have our staff involved and engage our patients who are going through the scleral lens process, so that as they come out of the exam room and they're scheduling follow-up visits or they're picking up lenses, we want our staff to engage that patient and say, how are they working for you? Aren't they great? And just, again, to be a source of encouragement and support to that patient who's going through the process. And this is something where our staff will bond with these patients and create an environment that's going to keep that patient coming back to you because of the bond they form. And in fact, this is just a picture of a fit that I did on one of my previous staff members. She's a mixed astigmat, and what was interesting was when she was given the opportunity to try scleral lenses, she commented on how clear the vision was. And so having gone back and known what her vision was for years, and knowing that she never really got a sharp 20/20 with soft lenses or glasses, with her scleral lenses she had better than 20/20 vision, the best that she'd ever seen. So that gave her a source of excitement about what they can do, and again, engage her in communicating with patients to form that bond. Along the same lines as having staff involved and encouraging them, we want to make sure that the staff, as well as the doctors and providers, understand some of the nuances of billing and coding. This can be a source of frustration for everybody. As practitioners, we want to get reimbursed for the work we do. We want this to be something that's profitable and yet beneficial to our patients as well. To make that happen, we need to have an understanding of proper billing techniques. And the last webinar we did a couple months ago that Stephanie did was a great resource for billing and coding. And there's other webinars available as well that talk about the nuances of billing and coding. So I would encourage you, if you don't feel comfortable with this area, to seek out some of these online resources for billing and coding. In addition to that, we need to have staff who understand this as well, and as has been pointed out in other places, it's great to have one staff person who really gets this whole process of scleral lens, medically necessary lens, billing and coding, that they understand the complexity, that they understand how to work for the appeals and things like that, work with the patients. And so this, again, it helps the patients to understand that you are an expert at this when your office understands the processes and the office is helpful in the entire process. Again, the billing part, you can do the best job of fitting of anybody in the world, but if the patient has frustration with the financial aspect of it, it will absolutely drive them to seek another provider, because this is a sticking point for most patients. It's important to be upfront with costs And again, just to be confident in what your fees are, not to hide them, but to be upfront with them so that billing and coding does not become a source of frustration that drives patients away. Again, really want to communicate upfront costs. I saw someone just today who was referred in for scleral lenses, and one of the first things she asked was, these are going to be covered by my insurance, right? And when I said it's not necessarily likely that they will, she was frustrated, but we immediately talked about how if they worked for her, that the cost of the lenses would certainly be worth it to her for the improvement in her life that they would give her even if she had to pay for them. And that we also explained that the lenses do come with a period of time where if they don't work, they can be returned for a partial credit toward the cost, and that also reassured. So having the upfront discussion with the patient, whether that's a staff person who specializes in billing and coding and fees, or whether it's the practitioner themselves, being really upfront with these this aspect of things is really bonds you to patients as well, because they know they can trust you and you're not trying to hide anything. You're just trying to do your best for the patient. You don't want the fees to become something that interferes with that process. So to really build a scleral lens practice, I think that you need to consider yourself a specialist. And optometry in particular has always been lax about taking on the role of the specialist. But I do think that if you want to really build a specialty lens practice that emphasizes scleral lenses, you need to consider yourself a specialist. And specialists approach the care of their patients a little bit different than generalists. So we need to be willing to have patients referred to us and to do the care that they're being referred for, and yet still allow other practitioners to manage other aspects of their care. So if we want referrals from other providers, we need to take good care of the patients, of course. We need that patient to go back to their doctor at some point and say how caring and how professional and what a good job that we did in the time we had with them. We also want to respect that relationship that exists between the referring doctor and that patient. They may have a very good relationship, and we certainly don't want to do anything to jeopardize that. We don't need to always assume that the patient coming in is going to have a complete exam with dilation and everything prior to us engaging in a fitting process. It may be true that they do need these things, but if they're being referred elsewhere where they've already had these things done, we need to be aware that it's inconvenient for the patient to have things repeated. And so we need to take a professional approach to this and decide what really needs to be done. Now, from a billing and coding perspective, there are certain things that you may need to repeat. If their insurance requires that you have done a refraction, for example, so you can demonstrate an improvement in best corrected acuity, or if you need to have a topography on a patient as part of that prior authorization or guarantee of coverage, then you need to do that anyway. I mean, that's part of getting insurance coverage perhaps. But again, we don't necessarily always want to be repeating things that have already been done. We need to learn to act like a specialist, which means we need to communicate with the referring doctor as well about our findings and our plans. Many of us refer patients out to other care providers for specialty care and advanced care, and we know how we like to be treated by those other physicians, other providers. So we need to take that same approach with these patients and treat the referring doctors, if we're going to get referrals, the way we would want to be treated as a referring doctor. And so that means perhaps a thank you letter with a summary of what we're doing, what the plan of action was, what the findings were. That communication will build another link with that provider. It will let them know that you appreciate the referral, that you're interested in receiving more referrals, and that they can count on you being aware of that relationship and that they're still involved in the care of this patient. We also, again, still want to allow referring providers to be involved with the patient's care in ways that it's not necessary for us to be involved with. We just need to be thankful for the opportunity to manage what we have been given the opportunity to manage. One thing that I've seen secondary and tertiary level providers, specialty providers do is to dictate a letter to a referring doctor in front of the patient. I think this is a powerful tool, and it's always impressed me as something that that I think is a good idea. It gives the opportunity for the patient to see that you are communicating back with the referring doctor, that everybody is in the loop, and it also gives the patient opportunity to hear what you're going to tell their doctor who's referred them, and so then to have one more opportunity to ask questions about what did you explain to them, why were you telling them this, or what did you mean by that. So it's an opportunity for the patient to kind of get closure on their visit and know that everybody has the same understanding. And it also ensures that the letter to the referring provider gets done right away, rather than that it gets slips through the cracks and it never ends up getting done. So if you have the opportunity to dictate at the time of the consultation and fitting and each visit while the patient is still there, I would encourage you to consider that. Another thing to consider as you move towards more of a referral or specialty model for those referred in patients is we want to treat them a little bit differently. We need to make sure that our staff is aware that these patients are referred in and that they're not our patients necessarily, but they're patients who we've been given the opportunity to involve with their care. So we need to treat them differently. We need to be respectful of that other doctor's relationship. We need to maybe somehow note in the chart, in the scheduling notes, in the computer system that this is a referred in patient and they're a patient of Dr. So-and-so, so that we're always aware that this is somebody who we don't want to take that relationship for granted. We want to continue to communicate even when we're beyond the process. So if we've worked with a patient who's currently happy in their scleral lenses, we're still going to want to follow them up on a regular basis so that as they return for follow-up care in the future, and hopefully they're doing well, that we can just do the things we need to do and then get back to that doctor and let them know we had the opportunity to see this patient again for just specifically care of their lenses and that things are going well or any changes we've decided to make. Another thing you can do internally is to develop other specialties that go along with fitting scleral lenses. For example, there is a percentage of patients who have severe dry eye or moderate dry eye who can get significant improvement in their quality of life with scleral lenses because of the tear reservoir. So if we develop a dry eye specialty within our practice and have equipment and testing that can be effective at diagnosing and treating and managing dry eye patients, that again maybe patients can be referred to the office for dry eye evaluations. This then will feed into a scleral lens practice as well. Promoting expertise in post-refractive surgery care is another thing. RK, LASIK patients, there's some people that had it done 15 years ago, 20 years ago, who are now presbyopic and looking for other ways of correcting vision. And personally, I think scleral lenses are my lens of choice for anybody who's post-surgical, post-refractive surgery. So making sure that patients know that you have expertise in managing a post-refractive eye will also feed into a scleral specialty practice. And then finally, irregular corneas are another area that can be more challenging to get into because those patients tend to already be locked in with practices. But getting involved with the internet and irregular cornea support groups is a way to introduce yourself to these patients, as well as many forms of external marketing that you can do as well. So before we spend the next segment on external marketing and externally building your practice, I wanted to stop here and see if anybody had any questions in particular about building your own knowledge base as well as internal marketing and internal preparation for a scleral lens practice.
Thank you, Jason. That was really helpful. You had a lot of great tips. So the first question we have is, I've been in practice for 30 plus years, fit 80 plus contact lens patient per month, and started fitting scleral lenses 8 months ago. My biggest struggle is all the tools that the patient needs to insert and remove the lenses. I have all the toys to fit and good results. The question is how one explains to the patient with regards to this, this stuff like solutions, plungers, etc.
Yeah, I think that that can be intimidating to a certain subset of patients. There's no question that one of the most difficult categories of patients that I've found to convert to sclerals, even though they may benefit from them, is the long-time GP wearer. So that patient who's been in GPs for 30 years and perhaps they present with some corneal staining or findings that of dryness that you feel like, this person probably is better off in a scleral lens for their ocular health. And so you discuss it with them and they seem to kind of be interested, and then just like you mentioned, you get out all the apparatus to do the lens and they think, boy, this is just a lot of monkeying around. I prefer just, the old pop in and pop out and off I go. So there's definitely that category of patient that is not going to accept all of the accessories that go with scleral lens wear as easily. I think what it comes down to is again, that's something which we discuss with patients as we begin the fitting process. They can see that we're using these tools, and we just make sure to let them know as we're doing these, doing the fitting, that this is something they'll also be doing, and they're going to need to use this to insert and the solution to fill and another remover. And again, if it seems that the patient is really put off by that, it's fair to step back and reassess whether this is appropriate. At the same time, again, really what for scleral lenses most of the time all it takes is to get the lens on the eye, give the patient the experience, and whatever inconvenience they may find that this process causes is worth the improved comfort and stability that they get from the lenses.
Great, thank you. The next question is, where can one find resources to learn the ins and outs of effective billing?
Yeah, I think as I was saying, I would start with Stephanie's webinar, which she did a couple months ago. And again, that is available on YouTube on the Scleral Lens Education Society. You can simply go to YouTube and search for it, and it's there. And then also on the GPLI website, they have in their webinar archive some resources also for effective billing and coding. I think these are the places I would start. And then there's also at some meetings, for example, the Global Specialty Lens Symposium has had as part of their fundamental session billing and coding for specialty lenses as a track there too. And I'm not sure, but they may have it again this year. So I think these webinars and these lectures put on at specialty lens meetings are probably the place I would start. And then again, to engage with a staff person to follow through on and see if they understand the process as well.
Thank you, Jason. Those are all really good resources. I would definitely agree. And then last question before we move on, how do you determine what is fair in terms of financial cost to the patient? I am unsure when a more complex fit like keratoconus or scleral multifocals, what that should be in cost to a patient needing compared to someone that needs single vision.
Yeah, I think at the end of the day, it requires a little bit of work, but the proper thing to do is to evaluate your anticipated chair time with each type of patient. Come up with an average and then calculate your chair time, what it costs you, and then come up with a fair price for your process based upon anticipated amount of total chair time over the course of the fitting. So it's something where you may have to do a half dozen fits and try to somehow monitor, again, the number of visits and the amount of time you spend at each appointment with a patient. And then if you have an idea of your chair time, and there's ways you can estimate it if you don't want to go through the process of actually doing the calculations on your own practice, you could use just a fair estimate value, which is available, I'm sure, if you search for it on the internet, to calculate what, in real terms, a scleral lens fitting takes up in terms of your time and your chair time and the effective cost of that. And then again, I think you want to charge a fair amount so that you can enjoy the process and know that this is a profitable process for you, and you can give the patient a reasonable amount of time. I think if we undercharge for the care, we find ourselves trying to cut corners with time and expedite the process, and again, that doesn't sit well with a patient who's perceptive.
Great. Those are all great tips. And let's save the rest of the questions until the end if you would like to continue, Jason.
Sure. So I'm going to launch into the last section here, and that's building your practice through external means. Kind of a last second ad here as I was thinking about it. I had the good fortune of being able to build a private practice, which was a specialty contact lens practice with my awesome partner, Brooke Messer, and the two of us spent 4 or 5 years building what became a very effective and busy specialty lens practice. That scleral lenses were a very large part of what we did. And I truly to this day believe that even though it seemed a mouthful at the time, by branding our practice, the Cornea and Contact Lens Institute of Minnesota, that when patients saw our name, whether it was in their insurance directory or through website searches, that they knew we were serious about contact lenses, that we were not just a regular practice trying to do contacts on the side, but it was the main focus and main emphasis of our practice. And that may have cost us some routine care, but we were willing to trade that for what we really were passionate about, and that was specialty contact lenses. Another thing is you can do if you already have a practice is to create a sub-practice within your general practice. And Melanie Fergozo down in San Antonio has a practice called Alamo Eye Care, and she has branded her Cornea and Contact Lens Institute of San Antonio as part of that practice. And so there's some separate marketing that occurs for each, and so that's another way to do it. Again, I think by branding yourself as a contact lens specialist right on the front door, it immediately gives people as their first connection to your office the idea that this is something you're very serious about and it's what you specialize in. You know, in 2015, probably the biggest source of ways to get new patients other than through referral is through the internet. Your website on your practice should be a big part of your external marketing. You should, whether you have a standalone website specifically for scleral lenses, or you choose to have dedicated pages on your office's website about scleral lenses. Scleral lenses need to be mentioned on your home page and on as many pages as they can be mentioned on, as well as a dedicated page. You need to obviously use search engine optimization. Everybody should be doing this always for their practice, just for benefit of marketing purposes. But again, scleral lenses should be a high priority in your search engine optimization process for your website. Again, the more places you mention them, the more places you can link your website to scleral lenses, the more people are going to find them when they search for somebody who does not only scleral lenses, but the things that you treat with them. So again, listing things like keratoconus or corneal transplant or dry eye as part of the things that you do will also drive people to your website. Having links to other websites is great as well. When search engines rank offices or businesses or websites, part of what they're looking for is they're looking for a spider web of interaction between other sites. So when you link your site to other websites, you are going to create a link that will catch people doing searches for that topic. So we try to link our website to other websites which are relevant to scleral lenses from an information standpoint. And again, that just helps improve our own ranking. So when someone searches generically for scleral lenses or something that scleral lenses can be utilized for, we're more likely to be toward the top of the hits. Patient support sites are another place that you can become involved. There are places on Facebook, the National Keratoconus Foundation, websites which specialize in patients who've had complications from surgery, severe dry eye, these sort of things. This is all, there's so much through the internet right now that's geared towards supporting people with these type of problems. You can go there and be a source of information and support people and give them good information without necessarily coming across as marketing yourself. And again, people will appreciate that, and over time they will gain a trust that will drive them to consider seeking care from you. There are also websites that you can become a part of. Contactlenses.org is one that lists GP fitters, and one of the attributes you can list on that ranking, for example, is that you do scleral lenses. Sclerallens.org, which is obviously the SLS website, you can be listed as a fellow and a fitter there. Also, different labs will have provider directories so that people can find the nearest place that utilizes their products. So again, just having yourself listed as many places as you can is only going to increase the odds. Even if each thing you do only generates a couple patients a year, if you do enough of them, that's going to result in dozens and dozens of patients finding you through the internet. And it may be wise to even have a staff person who helps and builds that part of your practice. Blogging is another thing that really is helpful. Again, blogging as part of your website gets search engine results. Because there's a lot of content there, and so many of the search engines look for content on topics. So doing a blog is another great way to talk about lenses, to increase your presence, increase your ranking in search engines, and also give patients an opportunity to get introduced to what you do in your practice through reading some of the things you blog about. It's a way to get to know somebody without actually meeting them in advance. Another thing that we did was to produce high quality brochures and information. When we're going to hand out brochures to patients, we don't want them looking tacky or cheap. We want to customize them. We want to create good information so that when we hand out brochures to other referral sources, whether it's a LASIK center, another optometrist, rheumatology office where they're going to potentially refer patients, this is a resource that they can give patients that introduce them to what we do, and that has our contact information there as well. Once you prepare the information that you want to disseminate, whether it's cards, brochures, we need to get them into the hands of into the hands of practitioners who can then turn around and hand them out to patients as they refer them to us. We've in the past had dedicated marketing personnel. This doesn't have to be a full-time job for somebody. If you have a small practice or if you're just starting out, you can potentially take somebody who's already on your staff who may just have a good way with people, who's very friendly and outgoing, and see if they'd be interested in taking a day a week to help market your scleral lens practice. And that might be as simple as making visits to other optometrists or ophthalmologists, to laser vision centers where they do LASIK exclusively. Other opportunities would be to rheumatologists, oncologists, and primary care physicians who have geriatric emphases, as all these patients are going to see people with dry eyes or palsies or different conditions that can benefit from scleral lenses. And so if they understand how the sclerals can benefit their patients, then that's a nice way for them to refer them to you. Another thing I would say is if there's other practices nearby, and maybe they're multi-specialty practices, and you kind of assume, gosh, they must have a person in their office already that does fittings. I wouldn't assume that, and especially if you're really taking your scleral lens fitting skills up to the highest level, they may do scleral lens fitting, but they may not have the interest or level of expertise. There may be somebody there who does them but doesn't really care to do them, and if they knew they had another outlet for referring patients for scleral lenses, they might take advantage of that and utilize it rather than doing it internally. So I would not hesitate to contact offices in your area, despite the fact that you think they may already do scleral lenses. Another thing is too, I've seen where some, especially ophthalmology practices, many of them don't take vision plans, and maybe your practice does take a vision insurance that they don't. So this is an opportunity for them to, rather than get into the headache of billing and coding and trying to collect for non-covered services, they would just as soon take that patient who has Blue Cross and IMED and send them to you because you take IMED and they don't, and that way everything's covered and the patient's happy and they can continue to care for the patient outside of their contact lenses. So these are just, again, I would just encourage you, don't make any assumptions about a practice. You may find that one of your best referral sources can actually be a practice where they already do scleral lenses, but you can bring something different than what they're doing. Again, other ODs, other contact lens technicians that don't fit scleral lenses, we just want to educate them on what they can do, the power of how good scleral lenses can make life for patients. So we want to talk about, make sure they're aware of what patients are a good referral for scleral lenses. We want to show them evidence in articles and publications which talk about the benefits of sclerals. Maybe if we've done any of these articles, we can show them our work, which shows us that we're a leader in the field. So, you know, offer to take on referrals from other practitioners. Let them know that you're happy to do that. And again, whether that's personally through contact on your own or whether that's through an external marketing person in your office. Be prepared to demonstrate to others how scleral lenses can be used and that you are able to provide those services. Local ophthalmology is another great place to market yourself. I've found increasingly over the last couple of years that ophthalmologists are more and more interested in scleral lenses, whether that's that they want their own staff to get more involved, their own providers to do them internally, or they want to have somewhere to refer them. I think the light bulb is coming on for most of the ophthalmologists around that they see the benefit of scleral lenses now more than ever. And so making sure that local ophthalmology knows what you're doing is, again, a huge potential source of referrals. And again, offering to co-manage. It seems so unusual to offer to take a patient from an MD and co-manage with them, as we're so used to co-managing on the other side where we're the referrer and they're the the person we're being referred to. But you can flip that around and you can say on these type of patients you can refer them to me and I'm happy to co-manage. And so you can really develop a very rewarding relationship with the ophthalmologist in the area if you can collaborate on patients in a way that goes both ways. There are also plenty of LASIK centers out there that don't do anything other than screen for and perform laser vision correction. Having filled in and worked part-time at these offices in the past, I can say personally, we ran into patients routinely who had corneal problems that would have benefited from scleral lenses. And so to have some place that they can hand that patient a card and say, you know, you're not a candidate for LASIK, you need to consider some contact lenses. Here's somebody who can show you the entire array of contact lens options that may help you. And also you may end up with those patients who've had refractive surgery and now after a period of follow-up maybe they've got some complications and the LASIK center is looking for somewhere to send them to try to come up with some solutions. So again, I think this is a great source of referrals from those direct-to-patient marketing LASIK centers. Rheumatology is another potential area that optometry really has an opportunity to collaborate, particularly in this realm with scleral lenses. They see so many patients who have ocular surface disease and dry eyes that this is really a great potential place to hit. So if you do have rheumatology in your area, again, I would try to schedule a time to meet with them and the office, not just the physicians, but the entire office, as a lot of times your best fans can be those other staff who work around the physicians, and let them know how scleral lenses can benefit patients with ocular surface disease. Provide them references from the medical journals which back up what you're saying. And finally, there's a small opportunity with oncology as well, as they manage patients with complications of chemotherapy, for example, or different types of just reactions that occur through the processes of managing a patient with different types of cancer where there's side effects on the ocular surface. And so again, letting them know that if they do have patients who experience complications to their eyes from the therapy they're undergoing, that you can potentially help them with scleral lenses. Once you're proficient in doing the scleral lenses, once you've kind of gone through the first part of this process and you're an expert, I would really consider that you, or encourage you to consider writing an article for publication. These are ways that you can get your name out to not necessarily just your local group, but to a larger spectrum of potential referral sources. It builds your credibility, and it's amazing how many patients I've had who have contacted me from an article I wrote 6 years ago or 8 years ago on scleral lenses for post-RK from all parts of the United States, wondering if they can come to see me for scleral lenses. And of course, what I usually say is there's somebody closer than me, but it's rewarding to have that outreach. And I have had patients come from great distances because they know that I have the expertise. So these type of articles are ways to establish yourself both with other practitioners as well as with patients. We've always been big ones in holding CE events in our office, if that's something which you can do in your area, to offer a free continuing education event sponsored perhaps by one of the labs that you work with on sclerals, that maybe talks a little bit about how sclerals can benefit patients, and then do some hands-on workshops so that people can see just what kind of benefit you can get from them. And offer a continuing education course. I mean, this costs a little bit, but the return on that small investment for putting on a CE event is absolutely worth it. And then again, hosting a workshop where a company may come in and support you with funds as well as fitting sets can be another area. And people would say, well, I don't want to teach everybody else in my area how to fit sclerals, but the reality is if you want to be the expert in your region in fitting sclerals, there's nothing wrong with having other people around you dabbling in it a little bit, because they also will understand the benefit, and then you can be their go-to person when they reach the end of the line with somebody who they're having trouble getting success with. They know they can turn to you to continue the process. Really networking is great as well, not only because it helps you build your skill level and gives you new ideas every day, but if patients have, or if providers have patients moving around, they're going to seek you out because they know that you fit sclerals. And they're, all the time, there's Facebook sites that are so great for collaboration and for seeking providers for patients who are relocating. So getting involved with social media with other scleral lens fitters is another great avenue for getting referrals. So educate the world, tell your patients, tell the world through social media. Let your staff be your biggest cheerleader, because they've experienced it and they see the impact that scleral lenses have on the lives of those patients who you help. And tell other members of the medical community what we already know, because a lot of them just haven't come to the realization yet that scleral lenses can really completely change lives. As you go through the process of building your scleral lens practice, be a little patient. It can take time. It took me a few years to get my practice to where I wanted it to be, but through, again, hitting each of these different methods and means of building a practice, each one individually will generate a small number of new patients. But when you come at this from several directions, and again, create the environment that that patients can tell that this is an important part of your practice, and then you hit all the different external marketing and internal marketing efforts simultaneously, you'll start to see referrals and new patients coming to you for scleral lenses on a daily basis. We would have days where we have 3 or 4 new patients coming specifically because they were looking for scleral lenses from all sorts of different sources. So it will take time, but once the patients start rolling in, it's very exciting and very rewarding. If you're new to sclerals, again, I would say that you need to get good at them. You can't just start building a practice when you're not very good at this. So work really hard right now as you're waiting for all your efforts to kick in at becoming an expert in fitting sclerals. Get your fellowship if you can, work on your websites, work with the labs, and seek out networking relationships to build your expertise. If you've been doing this for a while and you're ready to take it to the next level, make sure you get your fellowship again in the SLS if you already missed that part. Work harder at your website. Pay a little bit of money for somebody to really take your website and move it up several notches in terms of visibility and optimization. And then again, get out there once you're comfortable that you're good at fitting scleral lenses. Get out there and make sure everybody in the eye care and medical community around you that might potentially refer somebody to you is aware of exactly what you're doing. Long term, again, if you're already pretty expert at it, you're already starting to build a practice, it's already growing, and you just want to continue to see it grow, again, offer CE, write articles, do workshops, get involved with other specialties to feed into it, and just make sure that you put scleral lenses at a very high level, important front and center place in your practice and on your website. If you're not already a member of the Scleral Lens Education Society, you can become one just by simply visiting the website at www.sclerallens.org and signing up to become a member. It's free. You'll fill out an application form, and within a couple days you'll probably hear back that you have been approved once we verify you are who you say you are. To become a fellow in the Scleral Lens Society, again, there is a process, but if you're already fitting patients, it's simply a matter of writing up some case reports of those individuals that you fitted so you demonstrate your expertise. And once you've done that, you become a fellow where you can be listed in the directory as well as become involved with the happenings and the internal workings of the Scleral Lens Society and the things that we do, like giving webinars and workshops and becoming a member of the board or a committee so that you can have more of an impact on the scleral lens world. So that wraps up this webinar, and I'm happy to take questions for as long as people are interested in asking them.
Thank you, Jason. That was a really interesting and informative webinar. I think everybody gained a lot of tips and tricks for their own practices, so thank you so much for all of your information. And just a few questions here. Do you ever teach insertion and removal before ordering the lens? Because I've had a few patients who were very successful fits, but they could not learn how to insert.
That's a great thought. And yes, on occasion we'll do that, and it really comes down to whether the patient has time and the staff has time, and especially if the patient's coming from a distance where you really don't want to put them through the inconvenience of a 3-hour trip back to pick up lenses that they'll never be successful with. I can only think of a very small number of patients who haven't been able to accomplish insertion or removal. But I do think it's worth considering having that as part of the preliminary. And you can usually tell as you're going through the fitting process those that may be unsuccessful. They're typically the ones who are really difficult for you to apply and remove lenses from. So again, I would say we do it. It's not always to decide whether they're going to be successful or not. It's probably more frequently that they're coming from a distance and I'm trying to save them a trip if I can send them a pair of lenses and have them come back after they've tried them a few days. But again, another great way to think about it. The thing is that the labs are so great about taking lenses back too. So I'd almost hate to not take the opportunity to get somebody a pair of lenses and let them try. And if for some reason they're not successful, the cancellation privileges for most scleral lens labs is typically 100%.
Great, thank you. And another good question, if you write a prescription for the 0.9% inhalation solution, does insurance typically cover the expense?
I know that on occasion they will. I know some insurances do cover it. If you write a prescription for it, it's easier for them also to use flexible spending dollars if they have a FSA or HSA. So I think that that's a benefit. I know that locally there are pharmacies that will require it, even though it's technically not required. Um, but interestingly enough, I know that it seems to be easier and easier to get the vials for a fairly low cost through alternative means, and even being able to sell them in your practice. I think I spoke to someone earlier this week who says they're able to get these 100 count boxes for less than $10 a box, so they can resell them to patients for, again, less than $20 a box. So I do think that on occasion insurances will cover them, but I wouldn't guarantee that, or I wouldn't promise that to a patient.
Great. I would definitely agree with that. Some patients can use their flex spending for those inhalation solutions, so that's always a good option for them,
Mm-hmm.
but definitely don't guarantee anything, like Jason
Right.
said. Also, do you have any aids for insertion and removal that help patients with limited dexterity?
Sure. There are devices, stands that you can set up that will sit on a countertop, for example, a lighted stand where a little rubber, the little DMV tool can rest upon a lighted stand, and then the patient can use both hands to hold their eye apart and actually lower their eye down onto the lens. That's one way to do it. I think, again, having a lighted stand helps because it's easier to spot where the eye needs to go. The kind of drawing a blank here. The another option which I've done too, if you don't have access to an adaptive device like that, is just as an aside, the bottles of Revitalens. So if you have sample bottles of Revitalens in your office, like starter kits, if you cut off the bottom of a DMV, they fit really nicely over the tip of a bottle of Revitalens, and so you can create your own little makeshift stand for scleral lens application is another way to do it. Now, obviously, that's not going to be lighted, but again, it's just a way to see if that will help patients just by having the lens sitting down and letting them use both eyes instead. So I think again, the adaptive devices are probably the best you can do, but they can cost money and they're not always easy to have access to.
Great, thank you. And last question of the night. I think you answered this in the beginning of your lecture, but maybe you can elaborate a little bit more. I'm efficient with one type of scleral lens. Do you recommend trying others?
Sure, I think that, I definitely have my favorites where I'll probably use 3 different designs the vast majority of the time, but I am fortunate to have access to many, many types of lenses. And it's not uncommon. I just did a fitting today where I had somebody with a very unusual shaped sclera, and I pulled out into the 4th different diagnostic set trying to find a lens that would give the patient a good idea of what a well-fitted scleral lens could feel like because, again, just such an unusual scleral shape. And so again, I think that there's absolutely reasons to have access to more than one design. If you really want to be able to fit everybody, I think most fitting sets can work maybe 80% of the time. But if you want to be, the best, if you want to elevate your game in your area where you practice to be, recognized as a leader in this, you have to be able to fit 99%. And to get that, you're going to need probably a second and even a third fitting set that have some different characteristics than the one that you're proficient at now.
Excellent. Thank you, Jason. Well, thank you, Jason, for all of your information and such a great webinar with so many uh, tips and tricks for practitioners. I know everybody learned a ton tonight. And anybody that had some questions that we didn't answer, we'll try to get back to you via email sometime later this week or early next week. And on behalf of the Scleral Lens Education Society, we really want to thank you for participating in this webinar. This has been really fun for us, and we hope to continue with these webinar series. So thanks again to Dr. Jedlicka for all of his advice and knowledge, and thank you everybody for joining us. And everybody have a great night.